skyrocketing healthcare and insurance costs, extremely modest gains against chronic disease, thousands die yearly due to drug reactions. What can be done? Thomas Edison is quoted as declaring, "The doctor of the future will give no medicine, but interest his patients in diet and nutrition, exercise, and the care of the human frame. He will teach them about the cause of all disease." The doctors of the future are here. Welcome to Phase 3 Wellness with your host, Keith Henry, ND, one of the doctors of the future.
Good afternoon and welcome to Phase 3 Wellness again. I'm your host, Dr. Keith Henry, broadcasting from down here in the Orlando, Florida area. Glad that you could take time out of your busy day to be with me today. We have another insightful presentation here on Phase 3 Wellness. And we're going to follow the same outline that we always do. And we're first going to, in our Week in Natural News Review segment, the first segment, we're going to be talking about and analyzing LASIK eye surgery. You probably heard some of the commercials on either the radio or or seen some of the commercials on the television. But an interesting story came out this past week where a popular meteorologist, apparently as a result of her issues that she had with her LASIK surgery, apparently due to the intense pain or whatnot, led her, according to the official story, to commit suicide. And actually, there's the article that we're going to look at today kind of talks about this and a little bit and talks about it's not that uncommon for people to have some of these side effects when they go through this LASIK surgery. And so again, it makes interesting information just in the event that you're considering it or you may consider it in the future. I would highly recommend before any type of surgery that you try and give natural remedies a chance and give them a chance to work at the cellular level, and you may be surprised at what can be accomplished there. Also, I'll be discussing in this first segment, the Week in Natural News Review segment, the importance of fasting to help stave off disease and sickness. Fasting is actually one of the best, for lack of a better term, remedies that you can employ in not only preventing disease, but also helping to reverse disease as well as sickness. In our second segment, our Healing Food segment, and if you haven't listened before, this is the segment in which we talk about the benefits of a particular food. And today we're going to be talking about tomato and some of the benefits you can get from tomato. It is actually a powerhouse food to help prevent the body from becoming sick and developing disease. And even though we eat tomatoes, we might not always understand just how beneficial this food is for our system. And this is one of the reasons that we do the Healing Food segment is because many foods that we eat, we might not understand how well they function for the body or the benefits. And some foods that we might not like or might not necessarily eat as often as we should, we'll find once we realize the benefits of them, just how important they are and how much more often we should be consuming them. And lastly, in our Healing Herb segment, today we'll look at the herb Willow Bark, sometimes considered nature's aspirin. And it is an excellent remedy to help with prevent or to cut back or to reduce inflammation in the body. I am your host, Dr. Keith Henry. I want to thank you for joining me today. We're going to go ahead and get started with our first segment. This is our first segment, the Week in Natural News Review segment. If you haven't listened before, I am a naturopath, and we basically believe in healing from the physical, spiritual, mental/emotional perspective. When I address the spiritual side of healing, I address it from a Christian perspective. Others may address it from other spiritual disciplines. I address it from the Christian perspective because to me, based on all the things that I've seen and on personal experience, and I've been a practitioner, it seems to make more sense to me when you address the spiritual element from that angle. So again, let's get into our first article. Yeah, we're only going to be dealing with 2 articles today. Sometimes we deal with 3, but today we're going to be dealing with 2 articles. The first one, we're going to be talking about this issue with this LASIK surgery and the meteorologist who basically committed suicide, according to the news reports, And I say that according to the news reports because sometimes something comes out later, there was something else involved, but just as far as we know, what we're being told is reported suicide. And it came out this week in several different outlets. I read it in several different outlets on Fox News, etc. But I'm going to, this particular article I'm taking from naturalnews.com, and it's entitled LASIK Surgery Failure Drives TV Meteorologist to Commit Suicide Due to Intense Pain. And the article starts off by saying a popular TV meteorologist and mother of two has tragically taken her own life following LASIK eye surgery gone wrong. 35-year-old Jessica Starr's colleagues at Fox 2 Detroit tearfully announced the sad news to viewers last week. It says, the article says that before her death, she had spoken out publicly about her trouble recovering from the LASIK SMILE, S-M-I-L-E procedure. It's all capitalized, specific procedure LASIK. And the article points out how this form of LASIK, which gained FDA approval in 2016, involved a surgeon actually creating a piece of tissue in the cornea with a laser and then making a cut on the surface of the cornea through which the tissue is extracted and then discarded. As a result, this reshaped the cornea to correct nearsightedness, and recovery normally takes about a few days. That is basically what typically or normally happens. However, in her experience, it was a different outcome. After going through the surgery in October, she missed several weeks of work, according to this article, and then in a Facebook video explaining her absence when she returned to work on November the 13th, she was downcast, the article said, and she was dealing with blurry vision. She went on to say, quote, I am struggling a little bit, so I need all the prayers and well wishes. This is a hard go, end quote. She also asked for tips and said she was trying to stay strong and get through her recovery and hoped to have her vision back soon. A day later, however, the article says she reported that her first day back at work had been too much of a struggle and she needed more time off to recover. The article went on to say it would be her last post on Facebook. And now it is something to go to a procedure and to expect to be able to see better. Just to correct nearsightedness. Of course, she didn't know this was going to happen, but of course, I would much rather, and I'm sure she would much rather, had she known the outcome, would have to suffer or deal with the nearsightedness than to have to go with blurry vision all over and basically pain and whatever else whatever other symptoms that she was having. The article went on to point out how although most people who undergo this laser eye surgery don't experience or won't experience complications, for some the effects can be devastating. It said that around half of the patients studied in a 2017 FDA clinical trial developed distorted or blurred vision despite technical improvements to their vision, and they found some reluctance among patients to report effects to their doctors. That's around half of the patients studied, it said in 2017, in a clinical trial developed distorted or blurred vision. That's pretty high, half, 50%, close to 50%. It says around half, so it could have been 50% or roughly 48 or 49%. That's still pretty high. The article went on to point out further that some of the known risks of LASIK SMILE, of this particular procedure, the SMILE procedure that she underwent, include glare or halo vision, infection, worsening vision, debris entering the incision area, and the need for retreatment with a more invasive operation and blindness. It pointed out further that there was a 2008 FDA hearing where some patients testified that they struggled for years with burning eyes as well as blurred vision, and some families actually reported loved ones had lost jobs or been driven to suicide because of the LASIK complications. It's astounding to me that the pain and the results of this procedure is so overwhelming that it leads people to suicide. I'm not minimizing it. I couldn't imagine what they may be going through. The pain probably is pretty severe, and not only that, You also may not be able to see, and then you have this extraordinary pain. It's affecting your life. I can imagine that after a while it could be very emotionally and mentally taxing. And the article cites a 56-year-old Canadian father by the name of Paul Fitzpatrick, who actually wrote in his suicide note that post-laser eye surgery pain pushed him to take his own life. He said, the article says he wrote that he could no longer experience any kind of pleasure, adding, quote, just the pain of burning eyes inside my head and throughout myself since 1996. Pain, and more pain. Please forgive me for not being strong enough to cope. The past few months have been unbearable, end quote. So here we have this ongoing and probably very intense pain that's going to naturally lead to mental and emotional stress. And again, I really, I feel for these people when they've gone to try and get their sight improved, and they end up with pain so intense, and all of it, just the inability to be able to operate, because without probably not being able to see well, with blurry vision, etc. And so, but this is one of the reasons I wanted to do this article, was so that if you're considering doing LASIK, just understand, although this doesn't happen to most people, it does have, there are other side effects that you may not necessarily have all this pain, but you may actually have some other issues. So again, I would highly recommend that you try going through some non-invasive natural therapies, eye exercises, your diet. Many times what you're eating, and sometimes what's eating you. And just dealing with, as I talk about on here all the time, those laws of health, trust in the Creator, sunshine, exercise, water, air, rest, diet, and temperance or self-control, the entire package of healing. Sometimes you need to be cleaned out. Some people have had problems with their vision because they're constipated, because they need to be cleansed. So again, a whole body approach, mental, physical, spiritual, emotional. And again, I think that many of these surgeries would be pretty much non-necessary. Again, and living with blurred vision or living with nearsightedness or foresightedness would be far better, apparently, than what these people are going through, because I've never heard anyone being driven to suicide because of nearsightedness or foresightedness. The article went on to point out how his parents, Mr. Fitzpatrick here, report that he saw specialists in the U.S. and Europe, but the treatments and additional surgeries only made his pain worse. He ended up needing to walk with a cane and had planned to move back in with his parents for extra help shortly before he passed away. The article says further that the founder of a support group known as LASIK Complications, Paula Kofer, said that there were at least 10 other post-LASIK suicides in the U.S. that she was familiar with. And her particular website is dedicated to 27-year-old veteran Max Burleson Cronin, who killed himself in 2016 after suffering relentless pain, as well as losing the ability to see at night or to read screens. Wow. And the article says further that one video game developer told the New York Times that the pain he experiences well after getting LASIK is like hot grease in my eyes, 24/7. He said he regrets not researching the potential side effects better. Now, I would tell you this. If my eyesight were to begin to deteriorate and I had to make a choice with LASIK, that would definitely not be an option for me. After this story came out, I did a little more research into LASIK and begin to understand. Granted, the majority of people won't have these issues, but we don't know how many people are having issues. We don't know how many people may not be reporting it, because some people might not necessarily report that, okay, my eyes are not as, my vision is not better, but it's not worse, or I have this blurry vision, I thought it was going to help. So we just don't know. Many of these people might not be reporting it. And as a matter of fact, this article went on to say that many times doctors fail to inform patients that LASIK could cause permanent damage. and they've been criticized for doing little to dispel the widespread but mistaken belief that the procedure is foolproof, which is true. If you listen to the commercials and the ads, you would think that there's not going to be any problem, nothing's going to go wrong if you qualify. But the fact of the matter, as with most surgeries, there are going to be risks. And do the risk outweigh the rewards? Maybe, maybe not. In this case, anything dealing with your eyes, the risks are tenfold worse, I would say. The article closes out by saying that these suicides have actually driven home the point that it's essential to thoroughly research any medical procedure that you're considering using unbiased resources or unbiased sources. And really, the side effects of laser eye surgery might be uncommon, but the sheer devastation that they can cause needs to be publicized so people can make informed decisions. And so, again, condolences goes out to the families, especially of all of these people, but also the young lady that took her life. And again, I don't agree with suicide, but at the same time, you really can't put yourself in these people's place. Like the one man said, it feels like he has hot grease burning in his eyes 24/7. He can't see us. He can't see at night. Living that day in and day out, you have to have mercy on these people, or you have to have compassion and understanding and say, I can, even though I might not agree with suicide, I can understand being driven to such a. You can say you could sit in. Look from outside and say, you could understand why someone who's constantly suffering and have no way out of any relief may contemplate as a way of escaping from this suffering, which is physical, but also spills over into the emotional. So again, condolences to these people's families, and just understand that if you're going to be considering LASIK or any type of surgery on your eyes, you need to, or any type of surgery, or even any type of natural procedure, but it's good to just take responsibility for your health. Ask questions of your practitioner, be it a medical doctor or naturopath or herbalist or whoever. Ask questions if you have any questions about it. Ask them details, and also do your own independent research so that you are comfortable in your own mind with what's going to be done and what the potential benefits will be, weighed against the potential downsides. I am your host, Dr. Keith Henry. I am a naturopath. You're listening to Phase 3 Wellness, the podcast, and we also broadcast live on Blog Talk Radio. Let's move on to our second article. It's from healthnutnews.com. We're going to be analyzing second and final article in this segment. We're going to be analyzing the article that came out on the 14th, a couple of days ago, from healthnutnews.com. And we're going to be looking at an article that says, it's entitled, "Almost Everyone Overdoes It. It Devastates Your Midsection." And basically, the article is talking about why we should integrate, why most people overeat. They eat too many calories, and how intermittent fasting is a great benefit. The article starts off by pointing out how if we understand what makes for a healthy life, a healthy diet and lifestyle, we can, if we understand what comes with a healthy diet and lifestyle, we can understand that the times in which we live, these things have never been more important. And the article goes on to say further, shockingly, however, obesity has now become a greater global health crisis than hunger, and is the leading cause of disability and chronic illness around the world. So against obesity as opposed to hunger now is becoming an issue, the other extreme. The article says, on average, the global population is plagued by obesity-related pain and illness during the last 14 years of life, which takes a significant toll on the quality of life. So because of obesity, the average person around the world suffers from some type of sickness, disease, or illness on average the last 14 years of their life. The article says further that one lifestyle factor that appears to be driving not only obesity but also many chronic disease processes is the fact that people rarely avoid eating for more than 12 hours. And then the article cites Dr. Sachin Panda's research, where it shows that 90% of us eat across more than 12 hours a day. Now, one of the things you heard me encourage on here is 2 meals a day plan. 2 meals a day, unless you're in some type of job where you're expending it's a very physical job and you're expending a lot of energy. 2 meals a day is going to almost be found to be better than 3. Almost always going to be found to be better than 3. So as you think about it, if you eat a meal, say if you eat your breakfast, for instance, say you eat your breakfast at 7 or 8, and say you eat your final meal, your lunch or your dinner at 2:30 or 3 or 3:30, and then you don't eat any more until the next day. Now consider if you stop eating, let's say you eat your last meal, you finish eating by 3:30, and you don't eat any more until 7 the next morning. That is maybe 15 hours where you're fasting, and some of that time you're sleeping. So imagine how beneficial that is to the body, as opposed to what most people do and what many nutritionists recommend, eating a lot of small meals throughout the day. Now, I don't agree with that. I don't agree with the burden that it places on the gastrointestinal tract, the constant work, the burden that it places on the digestive organs as a whole, the pancreas, the constant work is going to wear out your organs prematurely. So that's why I don't agree with that mainstream, this idea of eating 10, 11, 12, 14 small meals. There's more to, I know a lot of people say, well, I get my energy and it helps my workouts and et cetera, et cetera, et cetera. But you have to take into account the sensibility of doing that and some of the other things that it's going to affect. Men and women were not made to eat that on that frequent a basis. It's just not. The body has to take energy to break that food down. The body needs to rest, needs to recuperate. Now, according to this article here, historically it says generous amounts of food were not accessible throughout the entire year, let alone 24/7, and evidently strongly shows your body simply isn't designed to run optimally when continuously fed, and will radically increase your risk for chronic degenerative disease when you readily violate this principle. I agree. And it goes on to say, if you eat throughout the day and never skip a meal, your body adapts to burning sugar as its primary fuel, which down-regulates enzymes that utilize and burn your stored fat. If you struggle to lose weight, this may well be a significant part of the problem. Your body has simply lost the metabolic flexibility to burn fat for fuel. Moreover, the article goes on to say, research has confirmed that many biological repair and rejuvenation processes take place in the absence of food, and this is another reason why all-day grazing triggers disease. In a nutshell, your body was designed to run on fat as its primary fuel, A, and B, cycle through periods of feast and famine. So again, when you violate those laws of health, this is the one, when we talk about this is when I talk about the laws of health, this one falls on the diet. Remember I said they're the laws of health: trust in the Creator, sunshine, exercise, water, air, rest, diet, and self-control / temperance. But there are subsections, and this falls under diet. And so one of the subsections that would fall under diet would be fasting, intermittent fasting. And this is what it's talking about here, about not grazing all day. It is amazing that intelligent people would buy into that. But let's look a little closer at this article. And it talks about how fasting, when you abstain from food either for a large part, fasting is basically defined as where you abstain from food either for a large part of each day or a few days each month, each week or month. And it's actually one of the oldest dietary interventions in the world, and modern science confirms that it can indeed have a profoundly beneficial influence on your health and longevity, the article says. And then the article cites a paper that was published in November 2018 called A Time to Fast in a review in an issue of Science. And it cites this article saying, quote, and quoting the article rather, saying, adjustment of meal size and frequency have emerged as powerful tools to ameliorate and postpone the onset of disease and delay aging, whereas periods of fasting with or without energy intake can have profound health benefits. They're still quoting this article entitled, this paper called Time to Fast out of Science. It says, the underlying physiological processes involve periodic shifts of metabolic fuel sources, promotion of repair mechanisms, and the optimization of energy utilization for cellular and organismal health. Future research endeavors should be directed to the integration of a balanced, nutritious diet with controlled meal size and patterns and periods of fasting to develop better strategies to prevent, postpone, and treat the socio-economical burden of chronic diseases associated with aging. In general, both prolonged reduction in daily caloric intake and periodic fasting cycles have the power to delay the onset of disease and increase longevity. So again, back to what we put in our mouth, or not put in our mouth, for the time that we eat and the time that we don't eat. Again, fasting I have used in my practice, and I recommend to those that I work with, have in the past, that they, if possible, get down to two meals a day. Now, if you're diabetic, it could be a little bit more challenging, but it can be done depending on once you get your blood sugar regulated. And because remember, if you're diabetic, your metabolism and everything is off anyway. So that means that you can't keep doing the same thing that you've always done, or you're not going to heal. And so it's very important to, and even if you're not a diabetic, if you're a healthy person, or if you're trying to help with reduce your aging and all these things, eating 2 meals a day is going to benefit you, and fasting also. Because remember, by eating 2 meals a day, as I've illustrated here, pointed out here, you're going to be fasting for 12, 13, 14 hours every day. And once you get used to it, it's not going to be anything that amazing. In fact, and some people, another thing is, let's say, for instance, if you say, okay, I'm going to eat a big meal, my breakfast should be the biggest, and then I'm going to eat my dinner. But let's say some people may say, okay, it's a little rough for me to do that. Okay, then we'll say your last meal, if eaten at all, should be a piece of fruit, which is not burdensome upon the body. It's not a lot for the body to break down, and also the body will extract some significant nutrients from those. So it's amazing benefit that you can get from fasting. The article goes on to say further, while there are many different types of fasting, the key component is the cycling of feeding and fasting. By mimicking the eating habits of our ancestors, you restore your body to a more natural state that allows a whole host of biochemical benefits to occur. And then they cite research published in Cell Metabolism, and they say that this research concluded that time-restricted eating not only prevented but also reversed obesity and related metabolic dysfunction. Then the article is going to point out how intermittent fasting is one of the most effective interventions to help reverse insulin resistance, shed excess weight, and also improve body composition. It can help decrease your risk of heart disease as well as cancer, protect cognitive function, that means your brain function, and increase longevity. And the article is going to point out how two core mechanisms responsible for these benefits are: one, improve insulin and leptin sensitivity and improve circulating glucose and lipid levels; and two, triggering your body to more effectively burn fat for fuel, which encourages your liver to create water-soluble fat called ketones that, one, burn far more effectively than carbs, thereby creating fewer reactive oxygen species, and secondarily, free radicals that can damage your cellular and mitochondrial cell membranes, proteins, and DNA. And it goes on to talk about some of the other benefits of intermittent fasting. I highly recommend that we introduce, and not only one way is, as I pointed out here, eating 2 meals a day, but also sometimes fasting for an entire day, for a 24-hour period. And so say you eat your last meal today at 3:30, you don't eat anything else until 3:30 the next day, just drink water. Or sometimes you can do a juice fast. Fruit juice fast or vegetable juice fast. These things can help your body tremendously. So again, fasting should be made a part. If you're sick or if you're trying to stay well, either way, fasting should play a role in your health. I am your host, Dr. Keith Henry, not ND. You are listening to Phase 3 Wellness, the Phase 3 Wellness podcast. We're going to pivot over to our healing food segment right now, and as we have about 15 minutes left, we're going to pivot over to our healing food segment. And as I pointed out in the beginning of the show, in this healing food segment, we're going to be discussing very briefly the tomato. And again, it's amazing that the tomato is actually a powerhouse food. Let's look at the tomato. First, we'll look at some of its nutritional profile, and then we'll look at some of the benefits, the health benefits that it contains. Now, tomatoes, fresh tomatoes, contain a lot of water. They're actually about 94%. Water is about 94% of their weight, and they also contain small amounts of carbohydrates, proteins, as well as fats. And they basically tomatoes also are very rich in therapeutic as well as nutritional value, as well as non-nutritional substances. So let's look at looking at the nutritional profile of tomato. In terms of vitamins, tomatoes are most in vitamin of the vitamins. They're most abundant in vitamin C, and they also have significant amounts. They contain vitamin B1. They have vitamin B2, B6, niacin. They also contain folates, as well as potassium. In terms of minerals, they contain potassium, etc. Now, although potassium is the highest level of mineral that they contain, or not, I shouldn't say the highest level of minerals contained, but in terms of amounts of minerals, they have more potassium than anything else. But they also contain iron. They contain magnesium as well as phosphorus. They are actually a pretty good source of iron, since they contain about 9 times as much iron as does milk per equal weight. And so again, they also have what I say were non-nutritive components, which basically did not. When I say non-nutritive, they're non-nutritive in the sense of traditionally, but the Creator didn't make any mistakes. So everything that He put into that food, here in this case tomato, it has nutritional value. Whether or not we have learned to recognize it is another story. So think about it. Tomatoes contain a small amount of soluble fiber. They have organic acids, which basically help diminishes the sugars. In other words, let me put it this way: malic and oxalic acid actually contribute to the tomato's unique flavor. So when I say they have organic acids, as the tomato ripens, the concentration of these acids diminish and its sugar content increases. So in spite of the acidic taste, which results from the presence of these acid substances, tomato actually has an alkalizing effect. So remember, you heard me talk about the pH balance and how you want your pH to be a little bit more alkaline than acid. So again, even though tomato does have that acidic, is considered to be acidic, associated with acidic food, it's actually it leaves an alkaline ash in the body. Again, it also contains lycopene, which this is the vegetable pigment. It's a carotenoid. It gives the vegetable, it gives tomato its reddish color. And not only that, lycopene is normally present in human blood plasma. Together with beta carotene, it is actually the most abundant carotenoid in the human body. So think about it. The Creator has put lycopene in significant amounts in tomatoes. Now think about this as we talk about the benefits of tomato. Lycopene is also found in the testicles, the prostate, etc. And it is extremely potent. It is actually and what we call an antioxidant. We've talked about that before. It's an extremely potent antioxidant. And it actually so when we think about when we're talking about tomato, one of the chief nutrients in it we talk about is lycopene. And because we're going to be talking about its benefits here in a minute for the prostate, which is one of its major benefits. Now, because I'm racing against the clock here, I still have one of the segments to go. I'm going to jump over to some of the benefits that is contained for specific instances of specific abnormalities. For instance, tomatoes in terms of prostate condition, there's been a variety of studies conducted at Harvard University that show that men who regularly eat fresh tomato as well as tomato sauce or juice are at much lower risk of developing prostate cancer. Just finished talking about lycopene. And again, this is the reason being because it's easy to explain, bearing in mind that the tomato is the richest food source of lycopene, which is the carotenoid that actually protects the cells of the prostate from oxidation as well as abnormal growth. So therefore, if we, based upon these studies from Harvard, then we can understand that regular tomato consumption in any form has been shown to be an important factor in the prevention of prostate cancer, which is one of the most frequent cancers that we find occurring amongst males. Also, let's look at tomato's ability, or its not its ability, but its benefit as being a blood alkalizer. They are actually remarkable blood alkalizers. So, and they basically help neutralize and eliminate metabolic waste products, most of which are acidic, which helps with as I just mentioned, that helps with the pH balance. Of course, tomatoes are also diuretic, thus facilitating the work of your kidneys. And if you eat them on a regular basis, which is highly recommended we do, it actually helps to basically cleanse the blood for those who might suffer from like gout. Eating tomatoes on a pretty consistent basis can actually help with that. Also, tomatoes can also be help. They can also help actually depress the immune system. Why? Because of their richness in vitamins and minerals, and above all, their content of antioxidants, the carotenoids like lycopene and beta carotene. They actually help naturally stimulate the immune functions of your body. They increase the infection fighting capacity of the immune system. So think about it. When you're eating tomatoes as well as many other foods, they actually work to help boost your immune system. So they work like natural antibiotics. And when I say natural antibiotics, not in the sense that you're taking a food and the food is going in and it's killing a bacteria of some sort, but it's actually enhancing the capability or the capacity of your immune system to do the same. So in that sense, it's working as an antibiotic. Again, tomatoes also work. They're beneficial for to help stave off arteriosclerosis as well as cancerous disorders. But we're out of time with regard to the tomato. So again, eat your tomatoes, especially if you're a male. You have a lot of lycopene in your prostate, etc., and you're going to get the highest amount of lycopene in tomatoes. So tomatoes, tomato sauce, fresh tomato, raw. Get tomatoes into your system. They're very important. You're listening to Phase 3 Wellness. I'm your host, Dr. Keith Henry. We're down to about the last 7 minutes. So I need to move over here now to our Healing Herb segment. And normally the show we run about an hour, but today we're going to run about 45 minutes. So I'm a little bit behind time. I normally would have right now we have probably about 15 minutes left roughly. But Willow Bark is what we want to talk about. It is essentially nature's aspirin. It is remember, aspirin is the most used medication in the world, and it's actually a close relative of white willow bark, or willow bark, sometimes called white willow bark, because it's taken from the bark of the willow tree. Now, if you go back, the Indians of North America used white willow bark to relieve headache, fever, and to ease aches and pains, as well as to help relieve the pain of rheumatism. Hippocrates, the father of modern medicine, considered the father of modern medicine, even used white willow bark to relieve pain and fever. Now, if we look at the nutritional profile of white willow bark consists of about 1,410 milligrams of calcium, and then this is based on calculated based on a zero moisture herb of 100 grams. Again, carbohydrate, it has 78.9%, dietary fiber 34.2%, magnesium 560 milligrams, niacin about 9.90 milligrams, phosphorus, potassium, protein, etc. Just an overview of the nutritional profile of willow bark that the Creator has built in this herb. Now, my white willow bark, or willow bark, is actually a proven painkiller, but it doesn't have the side effects of aspirin. Actually, white willow barks actually are typically slower acting than that of aspirin. That's why it's considered, and I'll tell you in a minute why it's considered nature's aspirin, because what we consider I go ahead and tell you now, because aspirin, the synthetic form of aspirin, was basically based upon the herbal form. It's just that essentially the molecular structure was pretty much copied, and the synthetic form was made of it by Bayer aspirin. So that's kind of like why it's considered white willow bark is considered nature's aspirin, because what we call aspirin got its start there. It's only the aspirin, the synthetic form of this aspirin. So it's natural aspirin, if we could use that term. And people have used it in the natural community. They use white willow bark for such conditions as fevers. They use it for minor infections, for acute as well as chronic rheumatic disorders, headaches, and pain caused by inflammation, etc. So again, it is aspirin is not aspirin, but rather white willow bark is definitely has proven its worth when it comes to healing. Now, if you look over to some of the science behind it, Penn State Hershey, Milton S. Hershey Medical Center, they point out that the bark of white willow contains salicin, which is a chemical rather similar to aspirin. And they go on to point out further, and I'm quoting, in combination with the herb's powerful anti-inflammatory plant compounds called flavonoids, salicin is thought to be responsible for the pain-relieving and anti-inflammatory effects of the herb. Now, again, it's coming from Penn State Hershey of Milton S. Hershey Medical Center. It goes on to say, in fact, in the 1800s, salicin was used to develop aspirin. White willow appears to bring pain relief more slowly than aspirin, but its effects may last longer. And then the same source points out how in a well-designed study of nearly 200 people with low back pain, those who received willow bark experienced a significant improvement in pain compared to those who received a placebo. The people who received higher doses of willow bark, which contained 240 milligrams of salicin, had more significant pain relief than those who received low doses in the amount of 120. So by doubling the dosage of the willow bark, they received significantly more pain relief. This is from Penn State Hershey, Milton S. Hershey Medical Center. They go on to say several studies show that willow is more effective at reducing pain from osteoarthritis than placebo. And they go on to point out how in a small study of people with osteoarthritis of the neck or lower back, those who received willow bark experienced significant improvement in symptoms compared to those who received a placebo. The same source says a similar study of 78 people hospitalized with osteoarthritis of the knee or hip joint found that people who received willow bark had significant pain relief compared to those who received a placebo. So as we talk about osteoarthritis and inflammation of the joints, etc., one of the things that is definitely something you're going to want to consider is white willow bark or willow bark. Many times you can buy it in the store, and you'll see it. You'll see it in capsules. You may see it in extract. I like to combine it with other herbs that are known to be anti-inflammatory herbs like turmeric and boswellia or frankincense. These things have a significant benefit when combined together. So again, you get those anti-inflammatory herbs. Those three alone, I would probably put in some, say, white willow bark, devil's claw, maybe some stinging nettle, and frankincense, and then add cayenne pepper to help dilate the vessels and send that combination throughout the bloodstream in an effective fashion. That's something that would be significantly. Now, that's not only something that I'm dreaming up here, but as I just sourced some science from the university, etc. So again, not only is there, quote, so-called folklore behind it, but it's also science. I am your host, Dr. Keith Henry. I'd like to thank you for joining me. If you started listening in the middle of the broadcast will be available in about probably a couple of minutes, 5 minutes maybe. You can go and listen to what you might have missed. I want to thank you for listening. And until next time, have a blessed week.